Hey there, it's Dr. Hart with Nursing with Hart, PhD. I covered a brief overview of the nursing process the other day, so I thought I would do some practice questions with you, just to give you an idea how to answer these types of questions and give you more of an overview of the nursing process. So let's get going. Okay, here we go. The nurse is reviewing a patient's database for significant changes and discovers that the patient has not voided in over 8 hours. The patient's kidney function lab results are abnormal, and the patient's oral intake has significantly decreased since previous shifts. Which step of the nursing process should the nurse proceed to after this review? Okay, we have letter A, diagnosis, B, planning, C, implementation, or D, evaluation. And I'll give you a minute to think about this one, and then we'll come back. Okay, and the correct answer on this one is A, diagnosis. So you have to understand what's going on in the stem of this question. What is happening? The nurse is reviewing the database for changes, and the nurse is looking at the fact that the patient hasn't voided in 8 hours, kidney function labs are abnormal, oral intake has decreased. So what is the nurse doing in this case? The nurse is performing an assessment. And there's some key words there. Reviewing is a key word, that the nurse is performing an assessment. So if the 5 steps of the nursing process are assessment, diagnosis, planning, implementation, and evaluation, the next step after assessment is diagnosis. Okay, the rest are not correct. Planning, it's not planning, implementation, or evaluation. Okay, all right, next one. In which order will the nurse use the nursing process steps during the clinical decision-making process? Number 1, evaluating goals. 2, assessing patient needs. 3, planning priorities of care. 4, determining nursing diagnoses. Or 5, implementing nursing interventions. So what you're going to do in this one, it's an order, a correct order question. So you're going to put these 5 choices, 1 through 5, in the correct order according to the nursing process steps. Okay, is it letter A, B, C? Is it A, 2, 4, 3, 5, 1, B, 4, 3, 2, 1, 5, C, 1, 2, 4, 5, 3, or D, 5, 1, 2, 3, 4? And I'll give you a minute to think about it, and we'll come back. Okay, we're back, and the correct answer on this one is letter A. 2, 4, 3, 5, 1 is the correct order of these answer choices according to the nursing process steps of assessment, diagnosis, planning, implementation, and evaluation. So letter A is 2. 2 is assessing, 4 is nursing diagnosis, 3 is planning, 5 is implementation, and 1 is evaluation. So you really have to take a close look at that one and determine. And in your unit exams and your NCLEX, you may get order questions like this, where you have to put things in the correct order, especially with the next gen questions that have come out. I've seen quite a few ordering questions like this. Next one. A patient exhibits the following symptoms: tachycardia, increased thirst, headache, decreased urine output, and increased body temperature. The nurse analyzes the data. Which nursing diagnosis will the nurse assign to the patient? Letter A, renal failure, B, hypothermia, C, deficient fluid volume, or D, nausea. And we'll give you a minute on this one. Okay, and I wanted to take a minute to just give you some examples. We'll give you the correct answer first is letter C, deficient fluid volume. These are the signs and symptoms of deficient fluid volume. And some examples of nursing diagnosis, a couple of examples would be ineffective airway clearance, which would be for asthma. If your patient has had a CVA or a stroke, you may use impaired physical mobility. Online, you can find any of these nursing diagnoses, or the textbook that you've been provided should have the nursing diagnosis in there according to the medical diagnosis. Okay, so these are the signs and symptoms of deficient fluid volume in your patient. So let's look at the other answer choices. Letter A, renal failure, is a medical diagnosis, so that's not correct. We're looking for a nursing diagnosis. Letter B, hypothermia, is also a medical diagnosis. And letter D, nausea, that's just a sign or symptom of something else that's going on in your patient. That is not a nursing diagnosis. All right, let's look at the next one. The nurse completes a thorough assessment of a patient and analyzes the data to identify a nursing diagnosis. Which step will the nurse take next in the nursing process? We have letter A, assessment, B, planning, C, diagnosis, or D, implementation. Okay, we'll give you a minute and we'll come back. Okay, let's come back to this one, and the correct answer is planning. Letter B, planning. So think of the nursing process and the 5 steps: assessment, diagnosis, planning, implementation, and evaluation. So the nurse completes a thorough assessment. That's your clue. The nurse has done the assessment of a patient and analyzes the data to identify a nursing diagnosis. So the nurse has conducted the assessment and has come up with a nursing diagnosis. So what comes after that? Think of ADPI. You've done the A and the D, so the nurse has to do next is the planning. So the answer is B, planning. All right, next one. This is kind of a long one, and some students do get tripped up on this one, so we're going to look at this very closely. A nurse administers an antihypertensive medication to a patient at a scheduled time of 0900. The nurse assistive personnel, the NAP, then reports to the nurse that the patient's blood pressure was low when it was taken at 8:30. The NAP states that they were busy and had not had a chance to tell the nurse yet. The patient begins to complain of feeling dizzy and lightheaded. The blood pressure is rechecked and it has dropped even lower. In which phase of the nursing process did the nurse first make an error? Is it letter A, assessment, B, nursing diagnosis, C, implementation, or D, evaluation? We'll give you a minute to really look at the stem of the question on this one. Okay, let's come back on this one. So remember, and I am going to cover some information on delegation, very important information that can definitely appear on your NCLEX. Delegation questions are very important. So when you do delegate to a UAP, NAP, whatever they're called, these are unlicensed assistive personnel who work at the hospital. The RN may delegate to the UAP, in this case NAP, but the RN nurse is ultimately responsible for the outcome of the patient. Okay, so here the NAP took the blood pressure, which was low at 830. Okay, and the nurse gives an antihypertensive at the scheduled time of 9 o'clock. NAP was busy, didn't report it to the nurse in time. The patient is now dizzy and lightheaded. The blood pressure is checked, and the blood pressure has dropped even lower. So where did the nurse first make the error? And that is in letter A, the assessment. Every time you give a blood pressure medication, the nurse has to check the blood pressure, okay? Or if your NAP has taken the blood pressure and you feel that that is adequate, if you trust their skills on taking vital signs, then you can use that. But otherwise, if you didn't have a blood pressure from the NAP, you have to take blood pressure before you give the antihypertensive or blood pressure medication. Same thing. So the blood pressure has dropped. The patient is at a high risk for falls at this point. Now they're feeling dizzy and lightheaded, high risk for falls. You can have a sentinel event, very serious incident from this. Just this simple scenario of forgetting to assess the blood pressure before you gave the blood pressure medication. So the other answers are incorrect, obviously. The nurse should have assessed the patient and taken the blood pressure before giving the blood pressure medication. Okay, next one. A nurse determines that the patient's condition has improved and has met expected outcomes. Which step of the nursing process is the nurse exhibiting? Letter A, assessment, B, diagnosis, C, planning, or D, evaluation. All right, we'll give you a minute to think about this one. Okay, let's come back to this one. The correct answer on this one is letter D, evaluation. What the nurse is doing in this case, by determining that the condition of the patient has improved and they've met their outcomes or goals, same thing, outcomes is another name for goals. I talked about that in the material that I covered. What step is the nurse in right now? So the nurse is evaluating the care plan. The nurse is evaluating whether or not the client has met their outcomes or goals. So that is the evaluation step of the nursing process. Next one, a nurse is providing a care plan. The nurse is providing nursing care to patients after completing a care plan from nursing diagnoses. In which step of the nursing process is the nurse? Letter A, assessment, B, diagnosis, C, planning, D, implementation. All right, we'll give you a minute and we'll come back. Okay, and the correct answer on this one is letter D, implementation. So the nurse is providing nursing care, that's your clue. In the implementation phase of the nursing process, this is where the nurse is providing care, whether it's giving a medication, whether it's raising the head of the bed, whether it's giving oxygen, any kind of patient education. All of these are interventions which are included in the implementation phase or step of the nursing process. Okay, think implementations. The interventions are conducted in the implementation phase. Okay, one more. The nurse is reviewing a patient's care plan. Which information will the nurse identify as a nursing intervention? A, the patient will ambulate in the hallway twice this shift using crutches correctly. B, impaired physical mobility related to inability to bear weight on right leg. C, the patient is unable to bear weight on right lower extremity. Or D, provide assistance while the patient walks in the hallway twice this shift with crutches. And we'll give you a minute on this last one to think about it. Okay, and the correct answer on this one is letter D, provide assistance while the patient walks in the hallway twice this shift with crutches. Some students get tripped up on this one also. So you're looking for a nursing intervention, okay? Let's look at the other answer choices. Letter A, the patient will ambulate in the hallway twice this shift using crutches correctly. Okay, the key words here in letter A are the patient will. So that is an outcome or a goal that is part of the care plan. Letter B, impaired physical mobility related to inability to bear weight on right leg. Okay, letter B is a nursing diagnosis. Impaired physical mobility is a nursing diagnosis. And letter C, the patient is unable to bear weight on right lower extremity. That's an assessment. Okay, you're observing, you're watching the patient walk, and you can see that they're unable to bear weight. Okay, once you become a nurse, you're going to find that you're automatically assessing everyone you see in the public. You can see someone in the drugstore, and you watch them walk, automatic. It's an automatic thing for you now as a nurse. You're going to assess everyone. And so that one is, well, letter D, to provide assistance while the patient walks in the hallway twice this shift with crutches. That is your nursing intervention. Okay, and that's it for these questions. I hope these help you to identify each of the 5 steps of the nursing process. If you like these and want to see more, please like, share, and subscribe to my YouTube channel, Nursing with Hart, PhD. We'll see you on the next one. Have a great day.